Good evening, everybody. I'm Rick Westover, and welcome to Ask the Specialist here on CMU Public Television. And tonight we ask the doctors. Have your questions ready. Again, welcome to the program tonight, and I want to introduce our two guests to you. We have first off Dr. John Blamoun, physician specializing in pulmonology and critical care medicine, also now director of cardiorespiratory courses at CMU's College of Medicine, which we're excited about as well. Dr. Blamoun, welcome to you.
Thank you.
Thank you for joining us. As we first launch into the program, you mentioned influenza. It's that time of year again. Who needs the shot? Where can we access those shots? And let's just get a little bit of information there.
Well, influenza, this is the season, as you mentioned, for people to get vaccinated, because we always have that fear inside our mind of the pandemic of influenza. Everybody should get vaccinated. Everybody above the age of 6 months should be vaccinated. We focus more on the people that has the comorbidities or chronic medical problems, but very much everybody above the age of 6 months should be vaccinated. The vaccines are available everywhere. This is the time to get vaccinated. We advise people to get vaccinated as soon as the vaccine is available in their area. There is a website which is flu.gov, and there is a you can put your zip code and you can find out where the vaccine is available in your area. You can ask your healthcare provider and they will provide it to you in the office. Great. So the vaccine is available everywhere.
All right, flu.gov was that website?
Flu.gov.
All right, very good. I also want to welcome in Dr. Henry Szelag, a family practice physician practicing in Wademan and also an adjunct assistant professor at CMU's College of Medicine. Welcome to you, sir.
Nice to be back, Rick.
Thanks for joining us. And we were talking a bit before the program about meningitis. There's been some talk about it. There's been a little outbreak, but it turns out maybe that's more fungal related. However, as we have students back in school, parents might be concerned, students might be concerned themselves about the issues of bacterial meningitis and so on. What do they need to do to be precautious about avoiding that?
Well, there is a meningococcal vaccine available, which is probably the most common one that affects students here on campus, and it is important to get vaccinated. And if you're exposed to someone who has been diagnosed as having contracted meningitis, then there are antibiotics that you can take orally that should protect you for that. So, but you know, a lot of times it's just one of these things where you don't really figure out how the individual had come down with it. But if you're in close proximity of someone who has been infected, then it is a good idea to get some treatment.
All right, very good.
Yes. Just to reassure everybody, the outbreak was not meningococcal meningitis. It was just a fungus, which is Aspergillus, and that was linked to steroid injections into the spine. And that's not transmitted from one individual to the other, so that's reassuring.
A finite group impacted. Okay,
right.
All right, very good. Dr. Szelag out of Freeland, a caller asking, how can allergies affect a cold and how should you treat it?
Well, a cold, by definition, is a viral infection, and we really don't have anything to treat the infection effectively. But this time of year, I'm seeing a lot of patients who are having allergy and respiratory symptoms. They're having nasal congestion, drainage, cough, and stuffiness. So if it indeed is due to allergies, then you want to try to minimize their reaction to it, and there's various approaches to that, and I'm sure Dr. Blamoun has seen his share of cases recently too, but I mean, I'm seeing quite a few now, and with nasal sprays and decongestants, antihistamines, and sometimes if they get into the respiratory in the lungs, then some inhalers and such.
All right. Yes?
I would like to, obviously, the people we focus the most on here, asthmatics, because if they get exposed to their allergens, that's how they get the asthma exacerbation. So we try to advise them to, over the years, learn what or they are allergic to and try to avoid it, because the best treatment is prevention, really, for asthmatic patients.
All right, very good, thank you there. And what about the case of chronic cough? That cough that just lingers, you can't get rid of it, but you don't know why you have it exactly. What's the answer there, Dr. Blamoun?
The cough, the three most common causes for cough are really acid reflux and rhinosinusitis, which is an inflammation in the upper airways involving the nose and the sinuses, and untreated or undiagnosed asthma. These are the three most common causes for cough. Usually the individual get a viral infection or an upper respiratory tract infection, and that triggers the cough. But if the cough does not go away, then he should ask his healthcare provider to look deep into these three causes, which is upper respiratory tract infection, rhinosinusitis or inflammation, and chronic sinusitis, acid reflux or GERD or gastroesophageal reflux disease, and cough variant asthma, or a sort of asthma that only present in the form of cough. And for that, each one of them has a certain test and question that you ask the patient. And once you identify it, then you can really treat the cough safely.
All right, and there was a word you mentioned there that brought up this other question here from Charlevoix. They note that an EMG was ordered. They're curious what that is, and also what is GERD that you had mentioned.
Well, GERD is acid reflux disease or gastroesophageal reflux disease, where it's basically the reflux of the acid from the stomach into the esophagus, and that reflux of the acid irritates the upper airway where there is some cough receptors, and that's one of the most common three causes of cough that we know. EMG is basically checking for nerve conduction, and that's basically to check muscle weakness and nerve conduction. But that has nothing to do with the cough.
All right, thank you much. Caller from Alpena, Dr. Szelag. If the blood pressure is fine and an EKG came out fine, but they're ordering an echocardiogram, should he go on for more excessive testing, or should he pay and go on? I guess what he's asking is, should the echocardiogram be bothered with if the blood pressure and EKG were fine?
Well, it appears that the individual is being evaluated for cardiac function. And EKG looks at one component, and basically the electrical currents going through the heart, and if there's some damage or some abnormalities or with the heart rhythm, then it can be helpful. Echocardiogram shows you some other parameters of heart function, how the valves are working and how effective it is in pumping the blood out of the chambers. So those are useful tools when someone's being evaluated. And you know, cardiac disease can be rather challenging because there are different components that can cause some problems. But just because the blood pressure is controlled and the EKG is normal does not mean that everything is okay. There's history, risk factors, what else is going on.
Get the test.
Yeah, get the test. If they're recommending it, get the test.
Sure. Caller from Reed City, noting that they're dizzy when she lays down, or she's dizzy when she lays down, and they're asking, could it be an inner ear infection? It's been going on for 2 weeks. Dr. Szelag?
You know, could have some inner ear issues there. Could have some fluid in the middle ear. And I have issues with a fair amount of patients having problems with positional vertigo, dizziness when they change positions. And as we mature, our balance center deep in the head, it's kind of like a seashell apparatus. It's got fluid and fine hairs in there, and when you change position, they move and send the signals to the brain. And sometimes things dry up, the hairs get a little stiffer, but if you get inflammation also, that can affect that. But it depends on other associated symptoms, how severe they are. Sometimes when people are not conditioned and, you know, they're not active and just, you know, they notice changes when they get up from sitting down or laying down, then, you know, maybe they need to exercise a little more, because sometimes some of these challenging maneuvers can be beneficial.
Okay, very good. A follow-up on the influenza shot, Dr. Blamoun out of Croswell. The caller asks, if you get the flu shot early, will it last the whole season?
Yes. the short answer is yes. The flu shot should cover the whole season of the flu. So,
All right,
yeah.
very good. If a woman had a complete hysterectomy, do they need to continue to have yearly pap smears? This caller from Merritt, Dr. Szelag.
Well, I assume when she's saying a complete hysterectomy, she had her ovaries removed also. And I typically don't perform the pap smears annually, and this is kind of a gray area because they can still have problems with some vaginal carcinoma. But typically the pap smear gets cells from the cervix and the endocervix, and that part is gone with a hysterectomy. But if she's had a hysterectomy, but the ovaries were left in place, you know, they still have a chance of having ovarian cancer, which can be difficult to diagnose, even on physical exams. So you got to kind of individualize the situation and to the person that you're taking care of.
All right, thank you much. Dr. Blamoun, we have a question from Twitter, and don't forget you can follow us at WCMU_ask the Twitter from Midland, and they ask, what are the symptoms of COPD and how is it treated?
Well, COPD stands for chronic obstructive pulmonary disease, and it has two components, really, emphysema and chronic bronchitis. And chronic bronchitis is, by definition, is cough and sputum production for 3 months out of 2 consecutive years. The symptoms of COPD is cough and sputum production and dyspnea. The treatment for COPD is really inhalers, which are bronchodilators that dilate the airway, the distal airways, which goes into spasm and chronic inflammation. And another component of the COPD treatment is anti-inflammatory, which is, on the most part, is inhaled steroid, which is the strongest anti-inflammatory that we can have. And the use of the combination of the bronchodilators and the anti-inflammatory inhaled steroid can actually get the disease under control. That's the treatment that people use on a daily basis. When they run into trouble, which what we call flare-up of the COPD or COPD exacerbation, they need bigger doses of steroid, which is, in the most part, we give it to them intravenously or by mouth. And they usually need also antibiotics because a lot of the COPD exacerbation are caused also by bacterial infection, not viral infection like asthma exacerbation.
Okay, all right, very good, thank you. Dr. Szelag, this person notes out of Alden that their son has had shingles twice in 4 months. He's 23, should he get the shot? Is there some way to cure? No.
If he's already been exposed, then the Zostavex vaccine is not necessary because he has been exposed. So.
Okay, very good. Excuse me. Kind of an involved question here that came through our email earlier, and comes from Mount Pleasant. We note, Dr. Blamoun, that we have an 11-year-old who has been going through quite a bit here with asthma. An asthma flare-up after years of only inhaler use with sports. Seemed to be going okay, and now sort of this flare-up. Hospitalized for some 3 days for pneumonia, sinus infection and ear infection. While she was sick, the coughing would cause her to vomit, and that would actually get rid of a lot of mucus. Up to 10 times per day this was occurring. She's still having a problem, but not near as often. Still vomiting some if she starts coughing or laughing, which then makes her cough. The hospital stay included IV steroids, breathing treatments, which continue, and a steroid inhaler, which continues, and she's been on 3 different types of antibiotics since that onset. Prevacid for vomiting reflux, blood test results just coming back, recommending some second course of antibiotics specific to the bacterial anemia. That's a lot to take in.
Right.
Do you pick up anything here that might be a concern?
What comes to mind when somebody that has asthma and start coughing and the cough is followed by vomiting, the common thing is the pertussis or whooping cough, and that's something that usually simple antibiotic like Zithromax or azithromycin usually is sufficient to treat. There is test for that. You can take a nasal swab, and that will diagnose the infection and you can treat it. Most of the time we don't do that because people go to their primary care physician and they get zithromycin, and that usually treat the condition. But it seems that this is uncontrolled asthma to me as well. So that individual maybe have still reactive airway disease that is not under control, and he might still need bigger doses of steroid, sometimes even intravenous steroid. Inhaled steroid most of the time take care of the problem, but sometimes people need bigger doses in the form of intravenous steroid.
All right, very good. And I sort of broke this up. For you, Dr. Szelag, this patient, this 11-year-old, is also recently been experiencing migraines, and they've been taking some over-the-counter medication to prevent them. And also has started seeing a chiropractor some 3 times a week for these migraine headaches. The instant migraine, it just comes on instantly at the base of the neck, immediately wrapping around to the front of the head. These have decreased to some 5 to 6 times a day, or from 5 to 6 times a day for 45 minutes at a time, to one every couple of days lasting maybe 10 to 12 minutes. Any thoughts? Is this course of action working? Is there something else that can be done?
You know, for someone this young that is having this many symptoms, I mean, I don't know what else is going on here, but migraines in and of themselves, this doesn't sound like the typical migraine pattern. You know, this could be more of a tension headache, especially if it's beginning in the neck, because migraines, by definition, typically occur within the skull, and it has some vascular component there. So, you know, there may be a combination of things going on. If she has these coughing spasms too, I don't know if that can trigger some headaches too. And I mean, when someone has some of these coughing issues, it can cause a lot of other symptoms there. But, you know, you need a good, I guess, assessment of the environment, the individual. Are there certain foods, certain precipitating factors? Is there correlation to other things that are happening? So, but with the adjustments, if she's getting some manipulation and if she's benefiting from it, then, you know, I'd say, yeah, it's probably reasonable to continue with it. But, you know, I don't know if that's going to eradicate the problem.
Another thing is, if somebody has a headache and has uncontrolled asthma symptoms, sinusitis can cause the same. Can cause both, can cause headache and can cause uncontrolled asthma symptoms. So it might be worth getting a CAT scan of the sinuses if the condition, you know, lasts for more than 4 to 6 weeks, and especially if they have discharge that is kind of purulent, thick, coming from the sinuses. Acid reflux also is a common cause for uncontrolled asthma. Uncontrolled asthma and cough itself can increase the pressure inside the chest, and that can cause headache by itself. Just the episodes of coughing can trigger a headache.
Okay, very good. I think a follow-up, but please feel free to redirect if necessary, Dr. Blamoun. This caller from Mount Pleasant saying that they're having symptoms of dizziness with the drug Plaquenil for RA. I'm not certain what that is. Already reduced to half dosage. Would it be better to stop taking this?
I would, Plaquenil is a good drug that's used mostly for like rheumatoid arthritis.
Okay.
But I would recommend that she check with her rheumatologist before discontinuing the drug.
Okay.
Because there are a lot of other drugs that can be used to treat rheumatoid arthritis. So if she's developing side effect to that medication, we have actually multiple drugs now that can just do a good job.
Okay,
so
very good. Caller from Oscoda, sort of a toss-up because I don't recognize the test that we're referencing here. They need a myelogram test. What do they look for when they run that test? Is there a risk involved? Gentlemen?
In the EMG, electromyelogram, I mean, I'm not sure if...
I have myelogram test on the
Yeah,
page.
and myelo refers to muscle, so they're probably looking for some kind of conduction study for muscle function to see if there's muscle or nerve problems there.
Okay.
So.
All right. Dr. Blamoun, you sort of were speaking about some acid issues and the chest congestion, and this question is, can acid reflux cause pressure in your chest? We've sort of hinted at that, yes, but maybe we can talk about how that causes that pressure.
Acid reflux can cause mostly the feeling of burning sensation inside the chest. which is really the reflux of the acid from the stomach into the esophagus. That acid also can go up all the way to the upper airways and can irritate cough receptors, and that can be a common cause for cough. But not every chest pain is really cardiac in origin. Sometimes the just acid reflux can cause similar pain that people can confuse for cardiac pain. A lot of the time also spasm in the esophagus can cause similar pain like cardiac pain. So acid reflux by itself can cause a lot of pain in that area, which is usually burning in sensation.
Okay, thank you very much. Caller from Atlanta, they have low diastolic blood pressure at 55. They want to know how to lower it without pharmaceuticals.
How to lower it?
How to lower it if
you know,
necessary. Why would you want to lower it if it's that low?
Right. I don't think that 55 is a bad number for diastolic pressure. And usually when we look at blood pressure, we look at both numbers, the systolic, which is the higher number, and the diastolic, the lower number. And what we typically find is that younger individuals, young adults, they have more issues with diastolic hypertension, where that number is higher, whereas when some of the more mature individuals, it's the systolic reading that becomes more challenging to control. So I think there's maybe a little confusion in that question there, is how it was asked.
Very good. Caller from Marion. A month ago, they suspected they passed a kidney stone. The doctor wants to have a bladder scan. Is this a good idea or necessary? The caller asked this because they note that they're 80 years of age and have had no problems since.
Well, if you have one episode and you think it's a stone and everything comes out okay, is it necessary to have further diagnostic studies? And, you know, that's kind of a gray area. If everything seems okay and there's no other underlying chronic conditions they have, if their kidney function is good, then I think it's reasonable to hold off and see what happens. But I guess to confirm that the kidneys are functioning okay and there aren't any obstructions, it may be useful information, but I wouldn't be too aggressive if that's the only case.
All right, very good. Reminder for folks as well, not only can you make your telephone calls, 800-727-9268, but now as we launch into the 21st century, yes, with Twitter, you can follow us there at WCMU_AskThe and ask your questions there, or via Facebook at facebook.com/AskTheSpecialists. Dr. Blamoun, is it common for people to not get asthma until they're adults? I mean, asthma, we just talked about an 11-year-old with asthma issues.
Right.
Is it more common later in age?
No, actually asthma is more in childhood, but there are some people who don't develop asthma until late age and not even adulthood. That's later in life that they develop their asthma. Most of the asthma symptoms develop really in early childhood. A lot of people who had developed childhood asthma, they outgrow it. They really get better with time. But the chances of recovery from childhood asthma is higher than the chances of an adulthood asthma that develop late in life.
Okay, thank you very much. Dr. Szelag out of Mason County, a caller asking what can be done to help with eczema?
Eczema, it's pretty much a chronic skin condition, and you can't find a specific cause for it. You have rashes, different parts. Oftentimes they're in some of the skin fold areas, your elbows, different areas behind the ear and knees and such. But typically we use topical steroid creams for it. And sometimes there are some precipitating irritants that the person may be exposed to that is bringing this on. So, you want to do a little detective work and see whether or not you can identify that. Occasionally, nerves. If people get anxious, sometimes you get a little increased incidence. But you want to avoid using excessively hot water when you bathe, and harsh soaps. Sometimes using topical emollients and moisturizing soaps can be a little more effective.
Okay. Dr. Blamoun, a caller from Lapeer, would the pneumonia shot help with chronic bronchitis?
We recommend the pneumonia shot for people who had chronic bronchitis and emphysema. They should get that before the age of 65, and if 5 years pass by above the age of 65, they can get another shot. It's these people with the chronic bronchitis and emphysema and COPD, they're more prone to develop chest infections, and pneumonia shot is recommended for all these individuals.
Okay.
Yep.
Just a couple of minutes left here, gentlemen. Dr. Szelag out of Farmington Hills, the caller says they have a burning sensation in their hands and sometimes the whole body, and it makes her hands and feet swell. It's like being burnt, she says. What might be going on?
Well, I mean, how old is the individual? Do they have problems with circulation? Do they have a neurologic problems? When you talk about the hands, oftentimes I will ask about the feet. Are they having any problems with their feet? With the hands, the first thing that I often ask you, you say, are you exposing yourself to something? What are you doing? Are you using harsh detergents? Are you, working with your hands, and are you sensitive to something? So, but I would need a little more history to maybe get a little more specific as far as how you pursue that.
Fair enough, fair enough. Dr. Blamoun, what are the common side effects of albuterol, and first, what does that work with?
Well, albuterol is a bronchodilator, which is, a bronchus is an airway, and a dilator that basically dilate the airway. That's the most common medication that we use to treat asthmatics and COPD who have bronchospasm, and bronchospasm basically constriction of the airway. The most common side effect of albuterol is tachycardia and feeling jittery and irritability. These are the most common side effect of albuterol.
All right, very good. Just down to probably our last question here, Dr. Szelag out of Farmington Hills. This person has gray patches on the scalp, and when she scratches, that burns. What is this? What can be done?
That could be a form of eczema also. Seborrheic dermatitis is a condition that often affects the scalp, and people present, they look like they got dandruff, got dry scalp. Typically, I will ask them about how hot of water they use when they shampoo, and I would recommend that they use a Selsun base shampoo. Head and Shoulders also could be effective, and what you do is you wet your hair first when you get in the shower, and not too hot of water, and you lather up, and then you shower, and then you let that stuff work for a while, and see if that'll work. So
very good, very good. I want to thank our guests today, John Blamoun, Dr. Blamoun, and Dr. Henry Szelag, both with ties to the CMU College of Medicine as well. We're excited about that here on the campus of CMU. Folks, I want to thank you for joining us. I want to thank our telephone operators as well, the crew here, and all of those who've offered up their questions. You made the program for us, and we appreciate it very much. Thank you, and join us next week for Ask the Senior Care Specialist here on CMU Public TV.